Hello, good morning. I'm going to present my research group. I want to thank the opportunity given by Anne and David to present our working work. We're a small but active research group with more than 10 years of experience, very committed to teacher training, physical education and health, and with a special interest in education for back-care and health. Throughout the presentation, we will see some pictures like this. This is a Valencian language. It's a take care your back. That shows the situation of potential problems caused by the lack of back care. The pictures are part of one of the projects developed by students in secondary school. World Health Research points to the practice of physical activity and physical exercise as one of the most effective prevention measures. These recommendations is the cause or are the cause of the strong impact on research in physical education and the treatment of its contents as a school subject. Research in physical education has focused on developing models and evaluating and implementing interventions that enable students to acquire active and healthy lifestyle habits. The perception of the role of school physical education is to make students aware of the importance of health, to be responsible with the commitment to acquire an active life and a healthy diet and to enjoy practicing physical activity. But with this situation, we ask ourselves some questions. Should this be the only role of physical education in health education? Should we clashes by concern with providing the time and type of physical activity necessary for a healthy life? That's possible. Well, be active and enjoy with physical activity should not be enough for physical education. Then, if we promote in physical education that our students be active, do physical activity, they say, I must do physical activity. If we raise awareness about the importance of having a healthy diet, they ask, or they say, I must have a healthy diet. If we get them to acquire active lifestyle, they thought or they say, I have a healthy lifestyle. That's enough to be a healthy life for our students. We cannot forget that the importance of knowing and using our body properly in our daily life and in the practice of physical activity and exercises, because we are forgetting an important point of the healthy life. And we ask why physical education research for health has currently forgotten back health or spine health. That's important for us. We maintain that the deep knowledge of oneself through the relationship with our body and environment must be a central axis of physical education. However, in our studies in the young population, we have detected that they have a low spec knowledge on the use of their body in activities in daily life. They have a low knowledge uh, of the practice of physical activity and specific exercises for back health, and they have an inappropriate postural habits. Then we have also observed an absence of studies on educational interventions and pedagogical training in the use of these contents. Research studies have been carried out mainly from the medical context, with a sick population and in the absence of valid and reliable measures instruments. Our research works to address these deficiencies, to address these problems from an educational perspective and in the educational context. So we ask ourselves, who is the subject of health education addressed in schools? Are there arguments that make it necessary to address the role of backcare in health education topics? What knowledge do I handle? What do students and teachers know about it? How can I approach and improve student learning? For this, we apply the Grossman model to transfer the expert knowledge of the content to a pedagogical content knowledge. First, we collect and organize the contrasted knowledge and study in its use and understanding in students and teachers. What they know, they have previous knowledge, students and teachers have previous knowledge. We analyze the presence and expressions in the curriculum, and finally, and perhaps the most exciting part, we design how to present it using instructional strategies that help to understanding, appropriation, and autonomous management of learning. Then we can say that we go from back health knowledge to the education for back health. But we consider that in this process, the treatment of back health content should be understood as an element within physical literacy and developed from this perspective. In summary, our research work we have carried out has consisted of first collecting expert knowledge, developing measures instruments, and finally developing and assessing intervention programs. As an example of collecting expert knowledge, we show the evidence that musculoskeletal conditions are the main burden of individuals, health systems, and social care systems, with indirect costs being predominant and especially back problems. Additional, a multifactorial effects of back health have been demonstrated. There are influences by history, family, age, gender, traumatic histories, sedentaries, and obviously a high level of physical activity, low flexibility, and weak muscles. Obviously, we have to consider psychosocial factors too. We have developed measures instruments adapted to the educational context, and there are three different kinds of instruments. You have developed these instruments not intended to evaluate the students. These instruments are the way to obtain information for subsequent informed pedagogical decision making. Then we have a questionnaire related knowledge in daily life and some other related knowledge practice of physical activity and exercise, specific exercise for back care, and the last one who was published recently in Masters in Physical Education and Exercise Science was a questionnaire about back health related postural habits in daily life activities. Well, our last publication on the development of instruments for measuring postural habits in daily life, in it we ask about the frequency. This is the article. We ask about the frequency of using correct or incorrect habits in postural of standing position, like brushing teeth, or like sitting position, natural position, or studying or working class at the classroom, or holding weight and carrying weight, also carrying backpack. Actually, we are using position sensors to assess the use of the body in habitual actions and to analyze how instructional teaching affect them. We say them, please take your backpack and hold in your shoulders, and then we show um, how they must to do this movement. We give them instructions to improve the actions. We assess whether the instructions have an effect on the action. Also, we have collected qualitative information through focus groups in both teachers and students before and after the interventions. We have some examples of work groups of teachers and a focus group of students. We have developed educational interventions in secondary and primary schools. We have designed intervention applying project-based learning using ecological models, uh, involving groups and teachers and students. We have done teacher training. We have a picture here. For developing an application of educative projects, we work with them to develop these interventions, and they practice and try to put in practice and prove the ideas about the activities. And the teacher have a development material for the activities to know, anchor the spine, and for the exhibition at the center we have one of the predictions, and this is one of their pictures, good habits and bad habits. And you can see this all over the school and all over the high school. And all the classes have one of them, and they used to do these exercises twice on a day. We have tried to involve families too, and they have learned to perform exercises stabilizes the trunk. They are working to know how to take care of their back. We have involved the different agents that surround the schools and institute. We have contacted and worked with politicians, uh, doctors in medical centers, and the libraries close to the school. They have put our pictures in the libraries. Well, and these have been our partners in the different projects, government, university, uh, libraries, different primary schools, high schools, and the medical center. Well, thank you very much for your attention, and this is all our presentation. Vicente is here at this moment. He can help you to answer the questions and try to explain all that we can do and all your curiosity. Thank you very much.